Alright guys, second episode of part 2 on ADHD and microdosing, and today is episode 118. The primary hypothesis that ND would reduce ADHD symptoms was confirmed, as findings showed decreased ADHD symptoms after 2 weeks of microdosing, with additional descent 2 weeks later. Using conventional ADHD medication seemed to delay the decrease in ADHD symptoms after MD. In line with expectations, increased well-being was reported at 2 and 4 weeks after microdosing. Additionally, MD-related changes in well-being and ADHD symptoms were negatively associated. Using conventional medication alongside MD or having comorbidities alongside ADHD did not change the effect of MD on ADHD symptoms and well-being after 4 weeks of MD in the current study. This is a study from 2022, so it's pretty recent. The results do not find support for the hypothesis that performance on a time perception task would be improved after microdosing for individuals with ADHD diagnosis or severe ADHD complaints. The decrease in ADHD symptoms after microdosing was in line with the earlier findings showing that MD, a self-medication used by people diagnosed with ADHD, was rated as being more effective than conventional treatment and increasing the quality of their life. Based on this, it can be said with more certainty that MD could be beneficial and of therapeutic value for individuals diagnosed with ADHD, even in addition to first-line pharmacological interventions. The current study samples, sorry, I kind of lost it. Based on this, it can be said with more certainty that MD could be beneficial and therapeutic value. The current study sample shows similar changes in the total symptom score compared to studies investigating the effect of several weeks of mindfulness-based cognitive therapy like CBT and treatment with methylphenidate in adults diagnosed with ADHD, which I find is surprising. You'll know why, because methylphenidate is like the strongest medication for me, to survive along with healing my other physical disabilities such as fibromyalgia and possible MS symptoms. And methylphenidate helps me stop from shaking. They tested me for Parkinson's, so I don't have it yet, but my hand, it trembles, and I know that I need the medication, so I don't know. Almost 20% of the sample at 4-week time point did not show improvements in ADHD symptoms. This lack of improvement did not seem related to using conventional medication alongside microdosing or having comorbidities alongside ADHD. ADHD in in adulthood is often overlooked. Need a coffee. ADHD in adulthood is often overlooked, which negatively affects the individual's well-being. First-line pharmacological interventions are effective in many ADHD patients, relieving symptoms rapidly. However, it works different for different people, and it's just like the same thing as ADHD medications, Concerta, Strattera, bifenton, Vyvanse, methylphenidate, which is Ritalin, all of the XR, extend release, and even like a daily dose release. If it works for some people, it does. If it doesn't, it doesn't. And I actually had one of the guys, a security guy that was working in the McKenzie Hospital, came up and asked me, it's like, how do you know you need to be taking your medication? Because he's on Concerta, and that is, he was on 34 or 36 milligrams of Concerta, the lowest dose. And that is a long-lasting extended release. So I never taken an extended release before, or I tried it, but it seemed to wear out, very, very fast because I have double the tolerance of other people. And the methylphenidate seems to be the only one that works for me. Me and my doctor tried everything, and we went back all the way to the first medication that was prescribed to me when I saw my psychiatrist at McGill University, so I don't turn out to be like my mom, who is a narcissist, and she doesn't understand me. She blames me for everything, think I'm a bad person. I don't do work, I don't do anything, I just bum around, so I don't know. Anyways, I'm rambling now. Bye.